coming through.
On this episode of Bondi Vet,
I'm a little bit concerned, team.
can Gerardo save this greedy Labrador after he ate 2 litres of yoghurt plus the container?
Oh, Carson. Only a Labrador would eat the whole container too, mate.
Who would let their dog turn into this?
It's
disgusting.
Scott helps a rescue Pomeranian in a shocking condition.
You're in good hands now, little one.
Yeah, where's our patient?
And Chris is urgently called out to the Australian Reptile Park to investigate the strange lumps spreading all over this koala's face.
If Jack's condition is contagious, it could be devastating to a koala population.
You make my world a better place.
Come on, there's your girl.
I can depend on you.
This is Carson. Carson's a 3-year-old who owners have just reported have eaten a large yoghurt container 3 days ago.
So like ate the yoghurt in the container?
No, the container as well.
At the Gold Coast Animal Emergency Hospital, Gerardo is confronted with a potentially life-threatening situation.
So he's vomited, owner feeds him and then he vomits it after he's been eaten pieces of container as well as his food, but he's also passing chunks of container as well and the species.
Wow. Oh, Carson. Hey, you're bringing up the container both ends. Only a Labrador would eat the whole container too, mate. Let's
Boy.
just check him over, hey?
The worry is that sharp pieces of plastic could be in his intestine, causing a blockage.
Good boy.
Good boy, Carson. I'm gonna have a feel of his belly, hey?
My biggest concern for Carson is that that yogurt tub is causing an obstruction within his gastrointestinal tract.
I can't feel anything, but it doesn't rule out that there's nothing sinister going on the inside, especially the fact that he's vomiting bits of container
Pooing
up
bits of
and
container
pooing
up.
bits of container.
We come home and found a container on the floor, large yoghurt container with big chunks missing off it, big sections gone. After having a look around the house, we couldn't find much plastic or anything, so we figured that he must have consumed most of the container.
Yes, he eats underwear, socks, anything he can get.
Yeah,
get
he's
hold
very
of.
mischievous.
Anything that's not at least 10 foot off the ground he can get to.
Yeah.
And he's been doing this for 3 years.
Well, let's go take an x-ray, hey? See what the x-ray tells us.
What we need to do now is perform some diagnostic tests to assess whether or not there are signs of obstruction in his gastrointestinal tract.
Are you ready, team, for x-ray? Okay, here we go. 1, 2, 3, lift. Oh, and then on the side. Good boy, Carson.
Good boy,
Good
good
boy, good boy. Okay, I'm going to slide you forward. Okay,
Good boy.
everyone out.
Good boy.
And then, so the thing I'm looking for here is to whether or not there is indication of an obstructive process. Oh, he does have some distended pieces of intestine there, which could mean an obstruction, but we need to take another couple views. A couple more x-rays, mate.
Good boy. Just on your back.
On your back. Oh,
boy.
stay still.
It's okay. Good boy. Good boy.
Good boy, Carson. Okay.
Boy. Just
Now.
sit here quietly for a minute. Good boy.
Hey,
good
handsome
boy.
man. Let's have a look at these x-rays. I'm a little bit concerned, team. So I see this area here. There is something going on in his stomach, and that's the reason why he's vomiting. So next step now, ultrasound. Have a look in the inside of his stomach and see if we could see something there.
To identify exactly where the yogurt container pieces are sitting in his stomach, Gerardo performs an ultrasound.
He's a big puppy. It's not the easiest abdomen to ultrasound. Okay, mate. Okay, mate. Good boy. There we go. So here's something just there. All right, team. I think it's all just in his stomach. Yeah, if it's been in for 3 days, it could have caused quite a lot of trauma on the inside. It's a good thing they brought him down rather than wait longer.
The rest of his intestine is empty. There's no obstruction there, so I don't think it's further. I don't think the issue's further down. I think it's all just related to the outflow of his stomach. Maybe we might make him vomit. If we can make him vomit and get some of that stuff out, it'll give us a bit of an answer as to what that is. Maybe scope. Maybe we might need to go to surgery. Okay, let's hope this works. I'm going to give Carson some apomorphine and hopefully he can vomit for us and bring whatever it is in his stomach up. Just going to rub this on the inside of his gums and then we're going to catch the vomit. Good boy, Carson. I know, matey. I'm going to rub it on the inside of your gum. I wonder if he ate the whole entire tub and that was full of yogurt as well. So he only ate about half the tub, but I don't know whether or not he ate the two litres of yogurt. That's a lot of yogurt.
That is a lot of yogurt.
Well, we won't have to hold back any hair. Oh, he's so close.
Yeah, super drooly.
Come on, mate. Oh.
Is that some sort of cloth?
There's some cloth in there. That may be a win. That may be a win. Time to go hunting for treasure. Oh, look at that. It's heaps of plastic. Heaps of plastic. Oh, look at that. Bit of cloth. Bit of cloth as well. We definitely ate the yogurt tub. And he decided to eat part of a tea towel. I wonder when he ate the tea towel. I can't imagine how that would pass through very easily. It all came out in a ball, which is what I believe was what we saw on X-ray and ultrasound. So once he finishes vomiting, I'm going to go and repeat the X-ray and see whether or not there's anything else left in his stomach. Fingers crossed, he's brought it all up. Can you come this way? Come on, Carson. Let's go, mate. We're going to take an X-ray. Okay, I'm going to just carry him. Coming through. Okay. I know you don't feel so good, matey. You sit here. Legs to us, Carson. On your side, matey. On your side. You've done this before. You know it's okay.
Good boy.
Good boy, Carson. Hey, trace fire when you're ready. Let's see what happens. And... oh! I think that was actually not too bad. Okay, we gotta rotate that around. That's that left side down? That was left side down? Okay, let's do a VD. But that looks better already. Fire at will, Commander. Okay, X-ray done. Okay. What we can see is in the last ones, there was this structure here with some gas around it, and then that repeat X-ray of the same side shows nothing. So, I believe we've been successful in removing that particular ball of what we now know as cloth and yogurt tub and some dog food.
Carson will stay under observation for the next few hours to make absolutely sure there's no plastic left in his stomach.
So I've heated up some chicken and I'm going to feed it to Carson. If Carson can eat this and keep it down, then he gets to go home. Okay, Carson, this is a test. If you refuse food, then there is something wrong because Labradors always eat. Let's test this out. Look, you're drooling a little bit. Don't bite my hand off. Good boy. Boom. Good boy. Little one. Bit more. Okay, I'm gonna trust you with the bowl. Are you gonna go for the bowl? Here we go. There's the bowl. Rum, 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 rum. Good boy, Carson. That's it, mate. Eat up the chicken. Eat up the chicken. So, you be a good boy. Carson, you be a good boy, and you keep that down. Okay? And if you do, you get to go home.
Later that day, it's time for Carson to be reunited with his family.
Who's in there?
And the Labrador couldn't be more excited.
Here we go. He pulled me through the door.
Did you miss us? We missed you. Missed you, baby. He's a beautiful dog. He's cheeky, mischievous, very loving, very affectionate.
Yeah.
Follows us everywhere, sleeps on our bed with us at night. So he's very much a big part of our lives.
He's done well.
Looked after well.
Cassie, you want to go home, mate?
I don't
You want to go home? Okay.
I think you might want to stay.
Good boy.
You going to go hunting some more yogurt tubs, mate?
Oh, no way, no more yogurt.
No more tubs for you, baby.
You've got to be a good boy.
All socks, all socks.
All
No more.
socks. No socks or tubs.
So fingers crossed we don't see Carson again, hey?
Oh, yes,
Good.
yes. Thank you so much.
All right, thanks very much for that.
Scott's making an early start this morning. He's on the road to an animal charity he often works with, All Dogs Matter.
They help to rescue and rehome abandoned dogs here in London. And they've just let me know of 4 dogs that have just come into their shelter that are in a really terrible state.
Hello, you 4.
Waiting for Scott is animal rescuer Sonia.
Hello.
Hi, baby.
Hello, you.
And the 4 new arrivals that were all saved from a local pound that could no longer house them.
They all look horrific, don't they? Their fur is in patches and tatty or even non-existent on that little Pom. I do think we need to have a little look at her and see what's going on. It was very clear from the get-go that the Pomeranian was the one that was struggling the most. She's the one that's lost the most amount of fur. She looks in the worst condition. She's very thin. She's struggling. I can see, well, clearly the biggest problem here is her skin and the complete lack of hair. So this has been going on for a while. She's lost a huge amount of fur as a result. Who would let their dog turn into this? I mean, it's disgusting. It really shocks me to the core, and to see a Pomeranian look like that, I just don't know how the people here do it, and I don't know how their hearts don't break every day.
She's also coming pregnant.
Oh, you're joking.
So, yeah.
And what happened to the puppy?
The puppy didn't survive. The puppy wasn't even a proper pup, so it wasn't even fully formed. So,
Sickening, isn't it? Really upsets you, doesn't it,
Yeah.
to see this?
It's heartbreaking. Everyone gets upset. You can't help it. You wouldn't be human if you didn't get upset about something like that. Sorry.
You're okay. We're going to sort you out. Hey, don't we? Can we sort you out? Hey? It's all right. Oh, hello. Hello. Wow, they're affectionate little ones, aren't they?
Come on.
All right, well, what I think we need to do is, all these guys look like their conditions are quite manageable, but this little one clearly needs my help.
Scott will now take the malnourished Pomeranian back to his Richmond practice
There you go.
to find out just what is causing her dramatic hair loss.
She's really stolen my heart, this little one.
Say goodbye to Sonia.
Bye-bye, darling.
We all get quite attached to the dogs down here. We might only spend a few days with them, but we love them all, as if they're our own, really. Okay.
I never understand how people can be cruel to animals. They're defenseless, innocent creatures. Why would you be mean to them? Why would you hurt them or neglect them? I just don't get it.
Take care. Bye-bye.
Come on then, beautiful. Let's go and see everyone.
Scott has arrived at the Richmond practice with the shockingly malnourished rescue dog that he's decided to name Kylie.
What's the matter with her?
Well, it's a long list of ailments that little Kylie's got going on, I'm afraid.
It's so sad. You're in good hands now, little one.
But the pint-sized Pomeranian is not the only special guest making an appearance today. Recently graduated vet Riaz is on his way to the practice for day one of his new career.
I've been working for this for the last 5 years, and now I can't wait to just get stuck in.
Hey, Riaz.
Hey, Scott. How you doing, mate?
I'm good, mate. How are you?
The rookie will be spending a 4-week placement at Scott's practices.
So, and here's our consult room. And it's Emma.
Hi.
This is our head nurse, Emma.
Hi. Nice to meet you.
Nice to meet you. How
Riaz,
you
new
doing?
grad, fresh off the press.
How fresh are we talking?
Oh, too fresh.
Yeah, as in like a day fresh.
Oh.
Yeah.
Like yesterday.
I'm glad the first person you met at the practice is our head nurse, because I would say, as a new grad, the person that you want to be besties with is definitely the head nurse.
So, the head vet, but you call the shots.
Yes. Yes, I do.
Yeah.
I'm glad we've established this hierarchy on day one. Get it right from the offset.
From the very beginning. So,
Brilliant.
you, Scrubs, you downstairs, and I'll bring the dog.
What Riaz doesn't know is just how shocking his first case will be.
I thought today that Kylie would really help to flex Riaz's veterinary muscles. So, guys, meet Kylie.
Oh, my God.
A baptism of fire to try and understand everything that's going wrong with this dog and what we can do to help her.
Right, well, let's get started then. Look how much hair she's lost. You can see right through to her skin, and you shouldn't really be able to do that at all.
We have virtually no history on this dog whatsoever, so we have to piece it together ourselves.
When Scott told me there was no history, it was literally like a nightmare. I was like, oh, can't I just have an easy vaccination or something to do? But I'm happy to do that, so bring it on.
We're going to start at the front of you, little girl, and work our way back, eh? Here, a little look inside. Oh, darling, you're missing quite a few teeth as well, aren't you? Skin's quite darker as well in patches. She must be really itchy. This is clearly something that just, not happened overnight.
I've never seen anything like Kylie. I think she's the first and hopefully the last time I ever see anything like that.
I mean, just looking at her tummy and her mammary glands here, she's clearly had puppies.
Well, you'll be horrified to know that just 2 days ago, she had a stillbirth at the kennels.
She didn't, okay.
Yeah.
Wow.
Oh.
Yeah.
It's not fair, is it? When I heard that she'd lost a puppy, I lost it myself. I broke down. I don't know if it's a maternal feeling, woman to woman, but the thought of losing your baby in a stillbirth, it just made me feel for her. It's just not fair.
So, Dr. Riaz, what do you think?
I think what we should find out first is the skin problem, whether it is a simple skin problem, whether it's just a parasite or something like that, or there's an underlying cause, perhaps. I think we should start with some skin scrapes.
Riaz is now carefully scraping away the top layer of Kylie's skin, trying to find evidence of the mites that are making her life a misery.
Lovely. That's great. Good work. Good job. Good girl, honey.
But the mites are notoriously elusive and can easily go undetected even under a microscope.
Where are you, little blighters? They're gonna be in here somewhere. So, guys, no mites found on this microscope slide. So what are we gonna think about that?
The fact that we haven't found it doesn't rule it out. So I think what we should do in the meantime is start treating for the mites and perhaps run an additional test to confirm the presence of it, something like a blood test.
Samples of Kylie's blood will now be sent away to the lab to confirm the team's clinical diagnosis.
It seems to us that the biggest likelihood is that Kylie is suffering with mange, and the best way to kill off a mange mite is by giving the dog a bath and start helping Kylie to recover and grow that fur back. Now you've got to give a dog a bath. A very technical job.
I'm very qualified for it. Let's do it.
I know. Come on then. Are we ready for your bath?
Oh.
I know.
Here she is, the star of the show.
We don't know yet if we're treating for which type of mange, so we're just gonna hit it hard. So we're just gonna not get her face too much. This bath is not the nicest thing. We're dressed up in masks and gloves because it's pretty strong stuff, and poor girl has just stood there taking it. So what we'll do with the rest of it is just sponge it on a little bit.
You get free tummy rubs. Hey? Hey, gorgeous. The way this works is it will kill the bugs from the outside, and hopefully make her feel a lot less itchy, and she can start to grow some of this hair back.
If it is just some bugs on the surface, then we should start seeing some progress in the next few weeks with regards to her hair coming back. I never thought that I'd get such an interesting and a bit bizarre case as I have today.
And with me, your first nurse.
That's true. How does it feel to take... No, I can't say that.
Your nursing virginity. I can't wait to see her full of hair again. I bet she's gorgeous.
Riaz is just relieved all of Kylie's problems can be fixed. It will be several days before blood test results will confirm just what type of mange is afflicting Kylie.
There you go.
All right, honey.
Gorgeous.
But for now, this lucky survivor will return to the care of rescuer Sonia.
All right then, honey.
She'll build up the malnourished dog's strength and get Kylie ready for a loving new home.
Say thanks, Riaz.
Bye, gorgeous. You're going
Go
to
on,
sleep well,
sweetheart.
aren't you? You'll never forget your first sort of patient, regardless of what it is. I think I'll remember Kylie forever.
All right, honey. Get you some dinner. Check get you some dinner.
Kylie, well done. Look at you. Well done.
Hello, Sonia.
Hi, Scott.
My God, Kylie!
It's been 5 weeks since Scott first met Kylie.
You look incredible.
Doesn't she?
She's an absolute vision, isn't she?
She looks fantastic. Did you recognise her?
Hardly. Well, first of all, she's got hair. It's incredible.
This was how the Pomeranian looked when Scott first saw her at the rescue shelter. Severely underweight and without most of her hair.
Who would let their dog turn into this?
Into
I mean,
this
it's
state.
disgusting.
The little girl was treated for mange mites, and she's now fully recovered and sporting a whole new look.
Hair on the
She's like,
face.
Look at me. Look at me. Her legs.
Hair on the legs. Hair on the tail. Look at that. Kylie looks absolutely amazing. I can't believe this is the same dog. She looks beautiful.
The blood tests have shown Kylie was under attack from the debilitating sarcoptic mange, better known as fox mange.
I think what the irony is here is that she had fox mange, and now she looks like
And
a fox.
you look like a fox.
Don't you?
You look like little Foxy.
Hey?
Foxy Kylie. Kylie is just loving the attention and she deserves it. So I say, go Kylie.
It won't be long now before Sonia will reluctantly allow the little Pomeranian to leave her care and go to a forever home.
She's just still there to be loved and to give love.
Beautiful foxy Kylie. Yeah. Good girl.
Hey Timmy, what's up? And you need me up there now? All right. I'll see you soon. All right, mate. Thank you. Bye.
Chris is responding to an SOS from Tim Faulkner, the General Manager of the Australian Reptile Park.
Tim's pretty good with his animals, so for him to have to call me in, you know, this has got to be serious. Hey Timmy.
Hi, mate.
How are you, buddy?
I'm good. Thanks for coming.
It's all right. Now, where's our patient?
I've called Chris to the reptile park today because one of our star koalas, Jack, he's 2 years old, has bumps all over his nose. We've never seen anything like it before, and it's important that Chris has a look and tells us what it is. That's the way.
There we go. Jeez, it's quite dramatic.
Have you ever seen it before?
Not like this. No, I mean, I've seen a similar sort of thing on other animals. But never on a koala. And never that dramatic. Now I can finally have a look at Jack. The reality of his problem is quite breathtaking.
Lips, eye, nose.
It's like he's got these volcanoes that have just erupted.
Yep. The thing for us is it life-threatening and is it contagious? And that's what we need to know.
How many koalas have you got here?
20?
Yeah.
Yep, and he's the only one with it now, and that's how we need to keep it. If Jack's condition is contagious, it could be devastating to a koala population. He's been housed with other koalas and it could already have spread.
It's not like they're scabs. I mean, they don't just come off if you grab hold of them. They're actually firmly attached and they almost look like they're coming from deeper within.
Yeah.
There's a couple of interesting things about this. I mean, the timing, for me, the fact that he's just coming into sexual maturity.
Yeah.
Maybe it could be related to that change in hormones that he's currently experiencing. The fact is, right now, everything's on the table in terms of what could be causing these lumps. They could be bacterial infections and over time they become fibrosed. Worst case scenario, it could be tumours. They've taken hold of all these parts of his body and are now starting to show their signs. The only way we're going to know is by taking a biopsy.
Yep.
We need to actually take a sample of those cells, look at them under the microscope and work out exactly what's happening.
Okay.
Koalas are already a threatened species. Their numbers are in massive decline simply because of bushfires, habitat destruction, and even chlamydia. Now, to potentially have another issue they're facing with what Jack has, it's not a good thing. Let's go. There we go. All right. Well, let's go and get that biopsy.
Right, 1, 2, 3. Chris and Tim have arrived at the Green Cross Veterinary Clinic, 5 minutes from the Australian Reptile Park.
Hello, how are you?
How are you?
Good. Jack's here for a bit of a nose job. All right, so we're going to get some gas into him here.
Vet nurse Narelle is helping to anaesthetise the little native, so a tissue sample can be taken from his nose.
There you go, mate, it's all right. Obviously, taking a biopsy in such a sensitive part of his body, he does need to be asleep for this, so that's why we're using the gas and the mask, and hopefully he'll be relaxed in just a moment. Good man. It's okay, man.
Being knocked out under anaesthetic, it's always a worry because that line rings true that native animals don't handle it as well as domestic, so I'm always right on edge, but have faith in the vet.
Okay, so we'll just be quick here. So the moment that mask comes away, we'll get this biopsy in there, spin it a few times, and then take this lump out. Okay, it's a nice fit on that one. The key with this biopsy is to take it nice and deep, get a full sample, and that way you know the pathologist has the best chance of giving us that answer we need.
The tissue sample will be sent to the lab for analysis. The results should be back within a few days.
Just putting a stitch in. This is clearly something that, as far as we know, hasn't ever happened before.
Yeah.
So, hopefully the answer will be in there.
Nice in there.
I reckon we're done, Narelle.
All right, can wake up, hey?
Any anaesthetic has its risks, and it's just why in this situation you can never relax, and so we're not going to take our eyes off him until he's well and truly awake. You use all sorts of little indicators to tell you when an animal is waking up. With a dog, they tend to chew. With a koala, their natural response is to grab hold of something. We'll know he's awake the moment he grabs hold of this finger here. The imaginary branch.
Breathing's getting faster. Hello, mate.
You all right, buddy? There it is.
He's got ya.
He's on now. The moment Jack does that to my hand, you know, he's back.
Hello, mate. You're all right. He wakes up and it's a relief.
We've managed to get Jack through today, but unfortunately his battles are far from over. It is going to be a nervous wait until we get his results back. Obviously, fingers crossed that they're not tumours and there's something we can actually treat.
Hello, Jackie boy. What's going on?
At the Australian Reptile Park, it's been a worrying time for Tim. Finally, Jack's biopsy results are in.
Unbelievable. He has acne. He's 2 years old. He's turning from a juvenile koala into a man. They do it at this age. And he's a pimple-faced teenager. The good news is it's not contagious. How's that nose of yours, buddy? How's that nose? Well, it's no worse.
The spotty teenager will need daily treatment.
Antiseptic wash first. Stay there. Thank you. I need to scrub up his nose, his lips, his eyes, and just keep it nice and clean and exfoliate a bit of that old skin. And then once it's clean and dry, apply some moisturiser. Come here, pal. There we go. That's a boy. A little bit round your mouth. That's you all done. It's such a relief. Now Jack can be like a normal teenager. And he's showing signs that he's ready to breathe, and that's a good thing. He needs those bumps cleared up to look good for the ladies. There you go, mate. See you tomorrow, Jack.